On the telephone is a guest. Our guest is Dr. Eric Dickson. Dr. Dickson is the president of the UMass Memorial Medical Group. Dr. Dickson, thanks for joining us this morning.
Thanks for having me on, Mike.
Sure. Hey, a quick shout out to you guys as well. It looks like U.S. News and World Report has listed you guys as one of the best hospitals. In fact, the top rank in the city of Worcester for the second year in a row. So what you're doing down there is obviously working, and my salute to you and all the hardworking professionals and everyone involved with the UMass Memorial Medical Center.
Thanks very much, Mike. We're very proud of the work that the people are doing at UMass Memorial.
Dr. Dickson, one of the things we wanted to talk about today, and it's a controversial topic, and that's the rising cost of health care. And I think it's something that hits everybody in perhaps different proportions. And I'm sure that must be a topic that is embraced at your facility as well. And I was wondering if you might have some thoughts on the topic of rising health care, why it costs so much and what measures people can do, whether you're a consumer or a provider, to perhaps rein in some of those costs.
If you look at what we spend in the United States on health care per person per year, it's in that $8,000 to $9,000 range, and that's twice as much as they spend in Canada, more than twice as much as they spend in Germany, Japan, and France, three of the highest performing healthcare systems in the world. And so we do spend too much on health care, I think, in the United States, and there's a price for that. We put our money into healthcare instead of putting it often into education of our youngest people. So we spend more now on Medicare in the United States than we do on K through 12 education, and it's a little bit scary to think that we're investing in the elderly instead of investing in the young by spending so much on healthcare, and it has a profound effect on our businesses, on our local economies, and we need to rein in those costs.
As a consumer, what can people do? I mean, there's all sorts of initiatives that we're told, whether it's from our healthcare providers or from our employers, in terms of get in shape, stay healthy, eat healthy, be more active. Are there other tips that you or others from UMass Memorial Medical Center provide to clients that you're working with?
I think one of the things that we always say to our patients is it's about preventive medicine first, and having that relationship with a primary care doctor that you can have a conversation with about how do you stay healthy, how do you keep out of the hospital, how do you manage your chronic illnesses so they don't flare, is absolutely key. And the other part of that is to have a conversation with your family about how you want to live the last year of your life. It's not about how you die, it's about how do you want the last year of your life to play out. And I think that in the United States, one of the reasons we have such high costs is that we fail to have that conversation, and often the spending that occurs in the last year of a person's life is more than the healthcare spending that has occurred up until that point and throughout the rest of their life. And you need to have those conversations with your family. You need to have a conversation with your primary care doctor about how you can stay healthy and keep your chronic diseases under control.
We're talking this morning with Dr. Eric Dickson. Dr. Dickson is the president of the UMass Memorial Medical Group. And Dr. Dickson, I think in many ways we're very fortunate to live in central Massachusetts, having access to world-renowned healthcare research that you folks are doing at the UMass Medical School. So I think if the unforeseen does happen, or if the unfortunate does happen, having a great facility like UMass Memorial Medical Group at our disposal certainly is comforting to all of us at the family level.
It's amazing to think that some of the lowest mortality rates for heart attack in the world are here in Worcester at UMass Memorial Medical Center. So some of the best survival for trauma is occurring over in the trauma center at the medical center, and some of the lowest cardiac surgery mortality rates in the world again are right there at the medical center. Cutting edge therapy that could really change this whole cost of care equation, find new cures for disease, education of students in a way that they are focused not only on delivering the highest quality care, but the lowest, most affordable care possible. I think it's an exciting time. I think I have a lot of hope because I get to work with these young students and these outstanding researchers and these wonderful clinicians. So, it's a good place to be if you get sick.
A lot of research is being done over there. A lot of breakthroughs are being done, especially in the cancer level. So I certainly applaud and support what you folks are doing over there. So we talk about the rising costs of healthcare, Dr. Dickson, but isn't the best healthcare system in the world that we enjoy around here, isn't it worth more?
I think that is true for what we call rescue care. I'm an emergency physician, and if something bad happens to you, this is where you want to be in the United States. And if that's a trauma, if that's a stroke, if that's a heart attack, again, some of the best mortality in the world is over at the medical center for acute myocardial infarction, heart attack. I think where the U.S. healthcare system falls down is in having that primary care physician be the coordinator of all that is going on and to keep you healthy. So we have about a third of our doctors in the United States are primary care, whereas in the rest of the industrialized world, more than half of the doctors practicing are primary care. And one of the things that has to happen for us to be able to change this equation is we need to make investments in primary care. I applaud some of the work that Medicare is doing right now and try to improve the payment system for primary care doctors. They're some of our lowest paid doctors. We put a premium on specialists and at the expense of our primary care physicians. I think that's going to be a key part of the transformation of our healthcare system and of the U.S. healthcare system. I think it's one of the only ways that we can get it done.
Dr. Dickson, I was reading your bio on the website, and I noticed you're an expert on the Toyota production system. So my question to you would be, what can we learn from a car manufacturer in terms of taking care of patients?
Yeah, Toyota is a fascinating company, and that I do think there is a lot that we can learn from them. If nothing else, every person in Toyota, everybody that works there feels like they have two jobs. One is to make cars, and the other is to find new, better ways to make cars. So they've got this army of innovators on the front line that are constantly improving quality and driving out cost. And what we would like to get from and learn from Toyota is how do we engage every nurse, every doctor, every therapist, everyone that is taking care of the patients, and let them have two jobs. Take great care of our patients, and on top of that, help us find new, better ways to take care of them. And the third part that we're incorporating in there is we want the patients to feel like they have a role in helping us improve. So as we create things like our patient and family advisory boards, where the patients are actually telling us this is what works well, this is what you need to improve on, and this is our recommendations, we can kind of accelerate our improvement journey and deliver better care for less.
We're talking with the president of the UMass Memorial Medical Group, Dr. Eric Dickson. And Dr. Dickson, if you were kind of looking into your crystal ball, are there future developments that people can kind of look forward to?
Well, I think as I see what's going on now and you look to the future, some people see doom and gloom. I am incredibly excited. I think that there's now a level of creative tension in the United States where people are saying, you know what, we love our healthcare system, but we want to pay less and we want it to deliver more. And that kind of creative tension is what allows for innovation and for us to look at new, better ways to provide care to patients. We've created a whole new department within the medical school that is focused not on developing new therapies, but on how do we apply the therapies we know work in a better way. How do we change the payment systems so that we can better align the work that people are doing with how the payment comes through. I'm seeing students now at first and second year medical students that are taking quality improvement electives and doing courses online about how do you improve quality and lower cost for healthcare. This was unheard of 5 and 10 years ago for medical students to be out of the anatomy labs and not focused on biochemistry and to be much more focused on quality improvement and process improvement. I see our industrial engineers and our Center for Innovation and Transformational Change redesign patient flow and engage the frontline staff in the improvement experiments. and we see kind of breakthrough levels of performance. I see new cancer therapies and new cutting-edge trials occurring in the cancer center, and it's just breathtaking to think of the collaboration between the medical school and the health system that occurs at our cancer center, the types of new therapies that could be developed there, and how well they could serve our patients. And so for me, it's a very, very exciting time in healthcare. And although it will be a somewhat painful transformation at times, we're going to emerge from this better and stronger than before. And we're going to serve our patients better by having gone through this transformation. And so it's an extremely exciting time in healthcare. It's an extremely exciting time at UMass Memorial. Great care being delivered. I'm here at Clinton Hospital today, where our emergency physicians from the trauma center come out and provide cutting-edge care out in the community, so patients don't have to come to Worcester all the time for that kind of care. Our cardiologists are here taking care of patients. We're getting the right care at the right place at the right time. So I'm excited about the future. When I look into the crystal ball, I think there's huge opportunities.
Well, Dr. Dickson, I wanted to thank you a lot for your information this morning. If people want to learn more, to be better educated consumers, do you have any recommendations in terms of where people can go, where patients can go to learn more about healthcare?
Yeah, I think you can always go to the UMass Memorial Healthcare website. There's a lot of other wonderful sites available out there. I'd recommend the Commonwealth Fund. Google that in, it'll bring you right to their webpage. And then the Institute of Healthcare Improvement, an organization right in Cambridge that is dedicated to improving healthcare here and around the world. There's great information available on the internet.
Well, I will also add in one on a self-serving, self-promotion type of idea, and that is a Health Watch segment that we involve doctors from the UMass Memorial Medical Center on a Health Watch segment every Thursday night on Worcester News Tonight. So I'm proud that we're aligned with you guys, and I think you're doing wonderful work down there, Dr. Dickson. And again, thank you so much for taking time out of your busy day today to join us on WTAG.
And thanks for having me on, Mike.
You're welcome, Dr. Dickson. Thank you. 19 minutes after 8 o'clock on Thursday morning. My name is